there's an elephant in the room.
Yes.
Some people, they find us slightly
scary.
We are here to talk about anxiety and fear in dentistry today.
Yeah. Doesn't matter if it's been 5 years since you
Right.
haven't been to the dentist or 10. Like,
It's true.
we're going to take it one step at a time and figure it out and how great you're going to feel once you come.
Dentistry today can be very anxiety-free. Hi, I'm Dr. David Fiorillo. I'm a general and cosmetic dentist in the Boston area.
Hi, I'm Dr. Sarah Filstrup. I'm a pediatric dentist in the Boston area.
This episode, we want to discuss something pretty important in dentistry. And as we've talked before, we love what we do. We're excited about dentistry. We love how we can change people's lives and make them feel amazing about themselves.
Yeah.
And we could talk to her blue in the face about how great things are and how we can, build their confidence and make them feel great and chew and all these different things and improve their health. But there's an elephant in the room.
Yes.
And it's hard for us to believe this. Some people, they find us slightly
scary.
And I don't get it. Like it's
I know.
I mean, how could we be scary people? What could we do to be scary?
I don't know.
So
it's out there.
Yeah. So we really want to address anxiety. We know it's a real thing. I mean, we've known ever since we've been dentists that, half the population doesn't.
I mean, my own father doesn't. Dad
right.
doesn't go to the dentist as much as he should.
I have a sister that's scared to death of a dentist. And I blame my other sister who's a dentist for causing that fear. Just, we're going to get that out right now. I'm not naming names, but if there's a sister that's related to me, you worked on her first. Okay. So that may be something that we could address afterwards. But yeah, apparently people are scared. They're scared of us.
I know.
And I think the old days and the movies don't help, right? Like
movies too. Where's the superhero dentist?
Right.
Flying through the air.
Right. There needs to be.
I'm her.
There needs to be the action hero. All the Marvel stuff nowadays. Why isn't there the dentist, by day?
Yeah, like ba-da-da.
And then boom, by night he is a, crime-stopping crusader, right? I actually have a few patients that are in the
literary
world, and I've been trying to really push the
so maybe
superhero dentist in there. But yeah, so I think we are here to talk about anxiety and fear in dentistry today.
Yeah.
So I know it's a big topic. It's a big issue, and I think a lot of it's bad memories, right? It's a bad experience.
Yeah, it's usually from childhood.
So,
right?
Having, a pediatric dentist that sets the,
kind of the stage.
Sets the stage. Thank you.
Yeah.
For carefree, enjoyable experience. It makes my job great. Like I don't have fear in dentistry because my patients see Sarah first and they're already loving what's going. In fact, I have the opposite. I have slight letdown because they're so excited about coming to the dentist to see Sarah, and then they don't really want to. Then they have to transition to an adult, and it's a little bit more challenging. But
it really, I mean,
how do you address that with parents? Like, how do you address? Like, by the way, when it comes to dentistry and scary, a 1-year-old is what's scary to me.
Yeah.
So tell me about how you solve that.
Yeah, I mean that's one of the things I hold highest in our visits. We start seeing children at age 1. It's not only to look at their, teeth and soft tissues and growth and development, but it's also to set the stage and coming to the dentist. To my team, I'm always like, we hold it the highest to make sure that this is a great experience, to make confident, comfortable kids coming to the dentist who actually have fun coming to the dentist. And we take it one step at a time. Every child's different. Every child's unique. And every child's path to a first visit is not the same. I might see some children that are having some, dental fears and things like that. I might see them once a week for a month's time to get them. In each visit, we might do one more thing. The first visit, we might just sit in the waiting room. The second visit, we might go and look at a dental operatory. The third visit, we might actually try to sit in the cozy chair. So just taking everything one step at a time at the child's speed is what we're all about.
So people may think, one? How do you see a child at one? I have this image, until I've actually seen it happen, and I'm a dentist, I have this idea of just holding the baby out there at one and be like, how am I even going to look in their mouth? Like, how do you, accomplish that?
Well, yeah, I mean, we do have to set expectations. And I know sometimes parents are like, I don't know, they're not going to sit in the chair. And no, they're not going to sit in the chair. We might do it with them sitting in their stroller. We often do what we call knee to knee or lap to lap, where the parent and I sit side by side and we lean back the child. The child's up looking at the parent. We're taking videos. I'm singing songs, and we just make it a fun experience for all. And it's a great way to show my parents, like, hey, if you need to get in the mouth and check things out, this is a great position. If two of you are at home together, you can do it just like we did. It really empowers them for their next stages.
I always remember you telling me about how, when they're screaming, it's great because you can liquor in their mouth, right?
Yeah.
So,
it's fine. I scream right back, and then they laugh.
Just so people know, there was a few weeks ago, we were still at the office late on a Friday night, and a patient called. The child had fallen and had hit a tooth, and so we were still there. So just come on down. It was a Friday night in the city. No worries. Just bring your child down. The tooth is knocked out or dislodged or something. I just remember sitting at my desk while you addressed the patient in the operatory with the dad. The screaming going on in that room, and it wasn't screaming that like pain. It was just screaming because it was a 1-year-old that was scared and anxiety. But I knew when she was kind of making that noise that you were getting the job done because you could actually see in her mouth at the same time.
Yeah.
So it was kind of a cool thing.
Yeah.
Afterwards, when she came out, she was so happy. She was like a little glowing little girl, right?
Yeah. And not only is she happy, but now you have parents that are happy knowing that, hey, we weren't sitting in the ER for 3 hours. We got to see our provider who knows our children and got to care for them in the way that we would care for our own family.
Yeah, that was pretty cool. I mean, it was fun. We got a good job done. So what if you didn't get the cool, fun pediatric dentist that gave you cute little prizes and all this kind of fun and really kind of listened to you? What if you didn't have the Mr. Rogers of pediatric dentistry, walking you through everything, and you had the terror, and now you're seeing someone like myself for larger treatment. Often you remember back in the day, kids would get, strapped to a board and sedated. Is that something that still happens nowadays, or is that like...
I don't think every child is different, and there's different modalities in which to do things. And there's times that we do have like nitrous oxide, or we do have something as an adjunct. And if that allows you to get to that next level and feel comfortable and confident, there's a reason why chemistries are out there. I think we use it in appropriate patient-centered ways.
Correct. I think when we try to start with the communication, and then if medications are necessary at some point, I think that works as well too. And I think those are great adjuncts. But in our world, I think what's worked the best is communication.
Yeah, absolutely.
And
taking the time.
And taking the time.
And listening, really listening, not just being like, oh, yeah. Really, what is their fear? Maybe it's something that's as simple as I don't want my legs above my head. It could be something.
Or big gaggers, a lot of kind of stuff. Or just I'm going to say this right now, big guys have a control issue. If you get in there and you have a blade on a block, you actually have to be more careful with the big guys than the smaller people. Women are always better at this.
Yeah. I know.
But I definitely think, going through this, we work with the patients, really communicate with them, walk through the problems. Like anything else, we show them ahead of time. We show them what we're going to be doing. So they really aren't scared when we get in there.
Yeah.
Yeah. And it really makes such a huge difference. And as I said, I've had patients that have been so anxious when they first started seeing us. And then after a few treatments of really just kind of, like you said, spending time just talking.
Yeah.
By the end, I'm like, you remember 5 visits ago, you used to hate this. Now you're like, hey, I love it. You love you guys. This is awesome. Can I get some more?
Why don't they become the biggest dental advocates? They're out there telling me, they're telling their friends, hey, you need to get to the dentist. They're taking great ownership, and they're proud.
Right.
They're prideful.
Which is awesome. It's great to see that. I mean, don't get me wrong. there's the sort of idea in the morning when you get up that like, you're tired, you don't go to work, but you're like, wow, there's 10 other people that have to get up this morning and go to the dentist. And that sort of motivates you. You're like, I mean, it's been overblown, you name it. Give me a movie, Marathon Man,
Well, that's where too, like, I mean, whether it be your adult patients or my young patients, having all these great visits. So then when we do maybe have a dental trauma or something that is more acute and we have to address it, like we've already banked this good feel zhuzh that when we have to do something that maybe is a little more challenging, they already know you, they already trust in you. They're already like, well, as long as I'm going to see Dr. Filstrup, I can do this. I can fix my tooth. It's no big deal.
Right.
So, and that, I mean, same with your adults. I mean, coming every 6 months, they're learning along the way from not only us, but our hygiene team and, the assistant team.
I just think this would all be so easy and solved if we could just get a Marvel character that was a dentist.
Yeah, I mean,
someone that was just badass out there that really just kind of like showed how exciting and not scary we are.
Yes, it's coming. I'm sure.
I'm sure it's going to come. It'll be we'll come up with some ideas. There's no, I mean, it's so hard for us to even grasp the concept. Like, there should be no fear anymore. Dentistry should not be scary. It should not be painful, right? You just have to take the time. You just have to listen. And I think that's what we, taking a step back and being a lot less volume and a lot more, care driven, I feel like that we're able to provide that to our patients.
And I mean, for my young patients, I mean, a really important thing is telling the truth. And I mean, I've had children that have come from other offices and they're like, that dentist said this and then did that. They didn't tell the truth. And for most children, I mean, parents are always, and everyone, you need to tell the truth. You need to tell the truth, whether it's going to be, what it's going to feel like, what it might smell like, the sensation might be like. Like, I give it to the children. They get it and they appreciate it, even if it's a little bit of a challenge we have to go through.
No, it's great.
Yeah.
And it's not all bribery. It's not all just prizes, right?
No,
of course not. That's not but that being said,
I mean, who doesn't want something amazing at the end?
But for me, I don't get that same sort of luxury, of giving my patients prizes, even though I think, we win the lottery someday and all of a sudden we have extra cash. It's going to be like, oh yeah, go pick yourself out a pair of Jimmy Choos. You did a great job in that root canal. People would love that,
Now, that being said, parents, I do not give frivolous prizes. They're all creative.
Sure.
So that it usually has to deal with art or science, just because I know from my own family members, they don't want another, I don't know, piece of something in their household. So
something sticky that's going to stick on the wall.
Yeah, nobody wants that. No.
Yeah. But no, we may stick with the whole big ticket items for adults at some point in time.
I mean, I'll come in.
Right. So, but yeah. So as I said, I don't think there's need to be scared in any of this anymore. And so the big key is, I'd say, communication.
Yeah.
Understanding.
That'd be number one.
Yeah. Sir, what are, for the parent that is got that scared child that doesn't want to go, what do they do with that child? Like, how do they get them to want to go to the dental office? Like, what are some tips and tricks for that, scared child?
I mean, there's a lot of great educational tools out there, from beautiful books that have been written to little videos that they can watch. But in terms when they're looking for a pediatric dentist, I mean, if available, I would look for a board-certified pediatric dentist. And what does that mean? It means that they've had additional training post-dental school, to really be able to dive into some of these fears and gain extra knowledge in how to care for children, and be able to take it from there. And then, I mean, the best thing you could do is go and meet some of these dentists.
I was going to say, do you think, do you like to meet your patients generally first before you do the treatment?
I mean, sometimes we just meet in the waiting room, and we'll just sit in the waiting room and we'll chat. We'll maybe even play, a little bit. Let them get to know me. Let the parent get to know me. Let the parent get to ask questions. Let the child see hey, this is an okay place to be. And then it will get you a sense on the office as well. Are you going to be able to see the same provider every time?
Right.
Are you going to have this nice continuous care? Because I think if maybe the child is so carefree, if you were to see, I don't know, me one day and then you the next day, maybe that wouldn't be so as important as someone that's just trying to take one little baby step at a time to get them to the point that we can, it might just be brush teeth. It might just be looking in the mouth for the first time. And when you have a provider that can really kind of slow things down, listen to what the parent's saying, listen to the child, and let them kind of guide you in your approach, is how I approach it.
Just so you know, I'm not in the office the same day as Sarah is, and say we have two different locations, so I don't see how she necessarily handles these children, but I get to see the parent afterwards, if they come see me and they'll talk about this is a great experience. And sometimes this happens every once in a while. I'll get a text from the parent of the child singing a song on my phone. And we often text our patients. So maybe you can explain, how the whole song concept works. Because I was like,
well, because we sing songs in the office. And it's a funny little thing. It's something I've always done when I'm doing an exam. It gives the child something to listen to. I didn't realize they would remember these songs and sing them back. But I have many parents that say they will only brush the teeth while singing the song, whether it be the brushing song or our flossing song. But it's just good fun. And if the kids are emulating it and doing it at home, it just melts my heart because it's how we do it. As one of my directors says, as a pediatric dentist, we wear many hats and we have different avenues and different approaches. And it is very, personalized. The way I practice pediatric dentistry might not be the same exact as one of my great colleagues. We're becoming different personalities. And I guess finding the right match for you and for your child is the best thing that you can do. And by meeting, it's okay to go and meet several dentists and figure out what's going to be a great fit, what's going to work for your child, what's going to make your child confident, comfortable, happy, excited, coming to the dentist.
Yeah, that's true. One of the things that I thought of was we always kind of think of like, it's going to be a scary thing. And I've had patients that have had no prior, bad experience, and they're petrified of going to the dentist. And I'm like, why? And like, well, I haven't gone in 10 years, and so they're literally scared of showing up and finding out something bad. I swear, it's always that patient that shows up that hasn't been in here in 10 years. We look in their mouth and there's nothing wrong. And they're like, what do you mean I don't have a cavity? What do you mean I don't have pain? Like, and that's not to say you should not go to the dentist every, for 10 years.
I hear that a lot when they call, or I overhear the front desk team. And as one of them says so all the time, like, we are no judgment zone here. Doesn't matter if it's been 5 years since you haven't been to the dentist or 10. Like,
it's true.
We're going to take it one step at a time and figure it out, and how great you're going to feel once you come.
Right.
And figure out if you do have needs or not have needs. Or
well, that's one of the ways to eliminate that anxiety is to go to a dentist that you trust, that has your best interest, and you go there frequently. You're there several times a year. You're there at least yearly, so you don't have that feeling that something's going to happen that you're not. That's not going to surprise you.
Absolutely. And I think a lot of my parents, I might see their child first because they're seeking out a pediatric dentist. And then they come and see our office and just get the feel of it. It doesn't feel like a traditional kind of dental office. Sure. It feels more like a spa, a tooth spa, we call it. And that the parents are like, my goodness, well, can I come here too? So sometimes that's a nice segue into if they haven't been to the dentist for a while,
True.
Then they have found a dental home. Not on my days, but
True. It always shocks me when I hear numbers like, half the population doesn't go to the dentist, and like that just blows my mind. But it's real, and it's like something that we should address more, and the fact that like a lot of it is just communication, and a lot of it's really understanding what the problem is, and then as you said, with your children, knowing what avenues we can do. There's different aspects. There's sedation. There's IV sedation. There's oral sedation. There's just different behavioral modifications that'll help people get through bad situations.
Yeah.
But I think just facing it and knowing that, dentistry today can be very anxiety free.
Well, one of the great things we do for the young children, well, for all children, adult children, it's called tell, show, do. You tell the child what you're going to be doing. You then show the child. So maybe you're showing them, oh, this is our little spinny toothbrush. And then they get to look at it and feel it on their finger. What is it going to feel like? Oh my gosh, this is tickly. And then you actually do it. Which tooth should we try? So I'm able to kind of really slow it down for my children. Like, is there something similar that you do for the adults?
We came out of school pretty similar time, and you had taught me a lot about how doing that with children. And I use that every day with adults. Like, I do not just jump in there and expect, well, because there's an adult, because they're older, because they've had dentistry done, that I can jump right in there and do it. I really actively try to walk them through each procedures. And every once in a while, it's sometimes frustrating when a patient goes, no, I don't want to know it. Just do it. Don't tell me anything about it. Just do it. And I'm like, what? No, I have to tell you. There's no way I'm not going to tell you. And so, and I'll kind of make a joke at him. I'm not doing this right now. I'm not actually going to be working on your tooth. But it's so inherent in what we do to educate the patient as we're doing it. It doesn't make any sense not to.
Yeah, you almost can't work without saying what you're doing and what it's going to feel like and what it should, be.
And I really take that from the pedos aspect. Yeah. And so it really has been a beneficial part of how I handle my patients. And it could be the smallest thing to a full mouth reconstruction. I am walking them through it, and they appreciate it. They know what's going on, and a joke. It's like, by the end of it, I want them to know more about dentistry than they've ever could have possibly known. And that gets rid of the fear. The anxiety drops right off. And they're like, hey, by the way, I noticed you didn't do this last time. I'm like, whoa, settle down. What do you get there? And so it's great. And I love that. I love that. My goal is to have my patients be more educated when it comes to dentistry than anyone they know.
And I would have to say we even take that not just from the time with us and in the chair, but we tell them what to expect, like from home, like in terms of when is the numbness going to wear off? What should it feel like? Yeah. What is it going to feel like day 2 or day 3? Right. Kind of guiding them. And then, tell me a little. I know you do the same as I. Like, you follow up with your patients.
It's true. We make we really go out of our way to make sure if I'm seeing a patient having any treatment, I always follow up the next day. I want to know how they're doing. I want to know what's going on, because that's when they have the question. They're like, should this be hurting a little bit? Should it be a little bit swollen? Even though I've walked them through it, I think it's important to kind of touch base with them. And I know I've had surgery before, and I remember being like, I gotta find this out, and I may even complain so much that my wife had then to call the surgeon. Maybe, and so I'm like, well, I'm actually that patient where my wife actually had to call the surgeon for me. But yeah, like, and I want that follow up, and I think by not following up, they didn't have that part.
It gives them a bit of time to process and to formulate that question that maybe while in the chair, all the activities happening, they're not thinking about.
Right.
It's really not. They're not thinking of what maybe the next step would be. So it's nice to
and that's all
touch base.
That's all the anxiety.
Yeah, and allay any fears or stress. Yeah.
And I think you can, with the right, the right techniques and the right communication and the right dentist and the right familiarity, you can solve that problem. You don't have to live with pain. You do not have to live with, the inability to chew well, or to feel like you can't fix your smile because it doesn't.
Yeah.
You're scared of.
Yeah. I feel like you can't smile with your teeth.
Right.
You're trying to cover.
Or you have
your
to
smile.
like just grin and bear it and not. And there's so many different ways and techniques to solve that it makes no sense to. That's what I say. It's hard for us to understand that someone would not get treatment. That being said, my sister still hasn't been in for like 10 years for like that. One of the things that we really want to get across is that you don't have to suffer. You do not have to.
Yeah.
And
you're not alone.
You aren't alone. There's
this is a fear of so many.
Right. And what we want to show is that you can improve the quality of your life and get rid of that anxiety and add that stress out of your life by, following some of these simple tricks, tips. And I think that part of it is just going to lead to a better life. It's going to not have that anxiety, not have that fear. We want you to know that life doesn't have to be the scary dentist, right?
Yeah. And I think as we all know, when we do something that we're fearful of or scared of doing, or it gives us a little apprehension, once you do it, you're so proud of yourself.
Right.
And then you might take the next step of something else that you were, I don't know, kind of waiting on.
That's true. And part of what we want to give you on these different podcasts is the strength to help build that relationship with your dentist and yourself, to know how to get through some of these things, some of these anxieties, some of the different things you didn't know about, to help improve your life. But yeah, so I think the fact that, there are so many different avenues that we can address these situations for people, and they're real. I mean, don't get me wrong. I know there's anxiety there, and I know people can believe it, and they, but
well, gosh, I mean, within our own families. So,
right,
and we're
true.
Dentists.
Right.
So, and daughters and sons, and, I mean.
No, it's true. I definitely think, but I think we can walk you through it. I think that, your dentist can really walk you through that, but you want the person that's going to really take the time to do that.
Yeah.
Not just medicate you, but to educate you. Ooh,
yeah.
I like that.
Education.
Educate.
It is.
Kind of like that.
It's key.
It's going to be part of my song. Okay.
I like this.
Okay.
It could be good.
I hope you stay tuned. I know we're going to cover some other good stuff, moving forward. Learning a little bit more about dentistry. We'll give you some quick tips.
Yeah. And tricks. And
yes. So
bits of knowledge.
I'm Dr. Fiorillo, and this is my wife.
I'm Sarah Filstrup. Thank you.